or go along to their screening. So, as you said earlier, it's about raising awareness. We want to increase understanding, and hopefully, this pilot project is such a success that we can take it to other areas in the county as well.
That's amazing. Thank you so much for that. Asha, you've worked closely with communities for some time now, haven't you? So why is this kind of approach important for people who might not usually engage with health services?
Like Hannah rightly said, this programme started in 2021 and we are 100% rollout in South Yorkshire and Bassetlaw. We are now trying to bridge that gap between ethnic groups and faith groups, because what we've noticed is the engagement sometimes is a challenge or a barrier from both ends, for faith communities or ethnic communities, and this is why we want to expand our awareness within those communities. Now, this sort of care across culture theme is very important in a way, because it's not everybody feels comfortable in asking questions. I mean, most people might be aware of this program but not really understand it or want to ask questions, just because they don't trust the traditional health services. And this is where we come in, and this is why we want to be in the community working with the faith groups and ethnic groups, where we want to be out there explaining what the program is about. And when it comes from a familiar face like yourselves, Mervyn, and other faith leaders or ethnic champions working within that community, it helps the program a lot, and that's why we want to be here. And I think my experience has been that when we do this such kind of work, the engagement is a lot better. People feel reassured. People want to ask questions, because sometimes for engagement there is that pre-engagement work that goes in the mind, like what is this about? Am I really eligible? If you're not eligible, why am I not eligible? These questions, once they're answered better, and I think people engage better, and then the word spreads, and then the awareness. And I think that's what I'm looking for, especially when working with yourselves or other faith communities. So that's been my experience, definitely, is coming from that familiar faces, trusted messengers, giving the opportunity to ask the questions back.
Yes.
And that's why we're here.
Thank you so much for that. Hannah, why isn't it enough to rely just on NHS letters, clinic appointments? What have you learnt?
We're all so different, and we respond to messages differently, generally, as well as sort of healthcare wise. Letters are really important. They'll always be the basis of how we engage with people and send out appointment confirmations and things, but especially in the 10-year health plan, and more recently the cancer plan that the government released, they are wanting to move from more traditional methods over to digital methods. So we need to sort of consider all avenues. Everybody engages differently, and relates to things differently. So we have, obviously the letters do go out in English, and we have put, is it 12? I thought it was 14. 12 different languages on the back of the letter, to, obviously that paragraph doesn't contain what the letter contains, but it signposts people to go and get more information, and just to give them a bit of an understanding about why they might have been invited, and how they can find more information about lung cancer screening in general. So there's that aspect, but also nothing beats the conversation, going out into the community, talking to people. I get the light bulb moments from people when I'm out at events, whether that be big ones like Rotherham Show or, local community events about well-being or stopping smoking and things. And they say, oh, well, for example, I stopped smoking 20 years ago. It will still benefit you to come along for your screening.
I
And
have a
then-
personal
exactly
because
exactly.
I started smoking in 2008
Very good.
and the cancer was found in 2023.
Yeah.
So just because you've stopped,
Yeah.
your health might feel better,
Yeah.
but you shouldn't say that, oh, well, I stopped 20 years ago. Because the other interesting thing that I found was that what they told me was that the form of cancer that I had in my lung is the one that most non-smokers and smokers get. That's what they said to me. Yeah.
So that covers everybody.
So that covers everybody, yeah. So, you know, I think it's really key from what you both are saying is that if you get a letter, if you get an invite, don't ignore it. Please don't ignore it. Do something about it. Asha, from your experience, what difference, I mean, you know, Hannah did touch on it, but what difference does it make when these conversations happen in familiar places rather than somewhere else? What's that key thing that you found in the work that you've done?
I think, again, coming from an ethnic background myself, I go to temples, mosques and churches, and I think these are part of our everyday lives. And, you know, at any point of time, whether a person is high or low, we do tend to reach out to religious spaces. And I think that's one place where people feel more relaxed, more trusting that, you know, that place.
Safe.
Absolutely. It's more safe for them to say things, talk about things, anything that you can't actually probably talk in a medical appointment. Like, you know, when you go to medical appointments, you just sat there listening because you don't want to miss a word what the doctor wants to say. So you're so cautiously listening, you forget to ask a lot of the time. And I think you come away with questions, and then that's like, oh, I should have asked those questions. But this is what, you know, what we found is in those safe spaces, such as the faith communities or mosques or temples or wherever it is, people feel much more relaxed and confident to ask the questions. And that's what actually helps the engagement, like somebody to take an action, is that understanding, like, you know what, it's just like another blood pressure monitor.
Yes.
It's just like another annual diabetes check that I can go and do it. It's nothing invasive, that sort of reassurance. And that coming from a safe place like that, you know, helps, it works. And we've seen that as, you know, evidence when we worked with you in the past. And I think that's what we want to take forwards.
I think what it is for me also is that, you know, I want to, you mentioned diabetes and blood pressure checks, and these are just normal things. We don't worry about them at all, do we? And I want to take that to cancer as well. So it's just another illness.
Yes.
Yeah.
Yeah. Because, and I talk about this quite a lot, 30 years ago, it was the C word.
Yeah.
We won't even say the name cancer. And now, cancer is out there. Yeah. And we want to change it into it's just another medical diagnosis that we can do something about. Yeah. Because there are lots of life-limiting illnesses apart from cancer, that you might have this illness for the rest of your life, but we can still help support you manage it, which is the key thing. And one of the key messages that we're hoping that, you know, with this lung cancer screening will be sort of these sessions, and tomorrow is the first one, isn't it, in Rotherham, is that we can help people to no, I'm not going to say that. I'm going to ask you, Asha, from what you hear in the community, what worries and misunderstandings tend to put people off?
Just like what you've just said, cancer, the word itself is a scary term, isn't it? It's like if they're screening for cancer, that means I've got a cancer.
Yes.
And that's the perception. And I think this is what we want to change. It's just a terminology, like a diabetes annual review, like a high blood pressure review. Doesn't mean, I mean, when they get diagnosed with a high blood pressure or diabetes, you're screened in a different way. Okay, it's just two different screening processes, and then you're given some level of treatment for it. It's exactly the same process. What it involves is just an additional scanning, just to be able to check the lungs. We have to look at the lungs. For us to have to look at the lungs, we need to scan. That's the only difference between your regular annual appointments and this one. So we want to normalize that, the misunderstanding that cancer means a death that leads to it. No, it doesn't. And you know, when you introduced me, you said, like, Hannah, seriously works with the communities and, communications, day in, day out. And I work with numbers, data.
Yes.
And this is what I take every day and I look at it. And when I listen to some of the treatment methods or treatment advancements that recently have come up, it's like 70% are cured. And
There we go.
that's reality.
That's a big number.
That's a very big number,
It's a big
and
number.
and it's growing and it's growing. And rest of the 30% doesn't mean there isn't any treatment. There is that lifespan, kind of you can expand your lifespan. Quality of life can be better. So there are treatments for that cancer, and I think this is where we're trying to get is that misunderstanding, misconception about what the screening means. I'm going to get diagnosed.
Yes.
It's not.
It's
That.
not.
That's the first thing. It's all about your check, your health, lung health check, and that's the first misunderstanding that we would like to clear. And the other is to be put out. If people want the numbers, we're happy to get those numbers to them. Explain that there is cure to there. 70% of people are in South Yorkshire now that we finished South Yorkshire 100% rollout, and we're doing round 2. The numbers are with us, and it's showing that 70% are being cured, and that's what we would like to reassure. Please take up on that program. It's just a misunderstanding. If you want to ask us questions, we're always available in
Yes.
shows like this with yourselves, or Hannah comes into the communities and I'm happy to join the sessions like we're doing tomorrow. And that's what I find is that biggest barrier
Yes.
for us.
No, that's great. Thank you. Just on numbers, because you mentioned numbers and I like data. So say out of 100 people who get invited for a lung screen, how many sort of go on further to have a scan?
And this is
Yeah.
30%, approximately
Is it?
30% go for a full scan, like for their checks. And within that 30%, good, again, 15 to 20% go for a consultant review just to make sure that everything's fine. It's like a second opinion, second check. And then that's where we are. Like, the numbers are very, very low. Once you cross that telephone lung health check, then the scanning, the amount of people that end up in the scan is very low. And to reassure you further, the scan is very non-invasive, very straightforward, and you will see in our videos that come out in public or in your shows, it's very, very non-invasive and it's not even painful to be putting it that way. So
No,
yeah.
it's not, because I went through it,
You've
and we
been
then
through it.
developed a walkthrough video, which
Yeah.
we'll be showing at these sessions, won't we?
Yeah.
I've also shared it on my LinkedIn and Facebook pages as well. So I think after this show and after tomorrow's, I'll share it again. It's a very simple process, And what's really reassuring for me is that out of 10 people, 7 have the telephone call and say, "You're fine, go away.
Yes.
We'll send you another letter in 2 years'
Yes.
time," which is amazing. Hannah, so you might have touched on this previously, but lung cancer screening program, faith communities. So the faith communities is how the program has responded to some concerns, isn't it? And misconceptions.
Yeah, and like Asha says, the data as well. We're finding that people who don't have English as a first language, and the ethnic minority communities, faith communities, are less likely to come forward. And we want to respond with solid, tangible information, if you like. Asha's just given a fabulous rundown of the stats, and that's I could say, you'll probably be all right, but
But probably
exactly,
and with Asha saying, "Well, look, this is the data.
this is what we found.
This is what we found," because we've doing it. You've been doing it for a while now, haven't
Yes,
we?
yes.
Since 2021.
2021, yes.
Yeah, 5
Yeah.
years,
So you've got real, reliable, actual, solid data.
Yes,
Yeah.
exactly.
And then people like me who've been through it,
yeah, living through.
as well, and lots of other people like me as well who've
Yeah,
had the screen and they've found, and and other people who've had a letter and been told after the nurse's telephone call, being told, "Look, you're fine.
yeah. You don't need a scan.
We'll send you another letter in 2 years," which is a really key thing, I think, for our listeners, is that just because you've got a letter does not mean that you've got cancer.
No.
It's just a screen
100%.
because you're in that age bracket where potentially we want to keep an eye on you.
Yeah. That's
Yeah.
all it is.
And please don't worry about it. Book that phone call. Yeah. If you just joined in, you are listening. If you just joined us, you are listening to Care Across Cultures with me, your host Mirban Hussain. I'm talking to the wonderful Asha and Hannah from South Yorkshire and Bassettlow Cancer Alliance about their amazing and wonderful lung cancer screening program for faith communities. Now, the first community session, Hannah, is taking place tomorrow in Rotherham
Yeah.
at the Unity Centre, isn't it?
Yeah.
Tell me a little bit about what's actually going to happen tomorrow.
Okay, well, it's going to be informal. You know, I want people to feel relaxed. I want people to feel comfortable. If they have any concerns or any questions, that they can come and ask them. I will obviously be giving out information, but I don't want people to be put off by, you know, it's a health information session. You know, I want to talk to people about it. It's going to be interactive. You're not going to be talked at. You'll be talked to and talked with. We'll be showing the video,
Yes.
so people can see what actually happens. At a scan
Demystify some of
Exactly.
it, doesn't it?
Myth busting, as
Yes,
they call
yeah,
it.
yeah.
But yeah, it's important to do that, because people, like you say, just because you've got a letter doesn't mean that you have cancer. You know, we all do it. We get things in our heads and, you know, put that to one side. Oh no, I don't want to know. Rather than just asking a few questions and feeling more at peace, understanding what it's all about. And I'm hoping that people will leave the session tomorrow and be able to talk to others about it.
That's a key thing, isn't it? Because what we're going to have is, although, what's the age range for the lung cancer screening? Is it 50 now?
55 to
55 to 74.
Yeah.
Now, we may not get a lot of people in that age range, but whoever comes will have family members, won't they?
Yeah.
And they can then share that knowledge. So part of this is about how do we share that knowledge and that understanding.
Yeah.
So the other key thing that I just wanted you to talk about was that you're doing this session in a community venue,
Yeah.
which is well known in Rotherham. You're also doing it with a community group,
Yeah.
which has been carrying on for a number of years. Now, so why?
Why that?
Why are you doing that with that, you know, what's the reasoning behind it?
Well, sort of covered it slightly before.
You've said
You
it.
know, it's the data, and they get called various things. Seldom heard groups.
Yes.
Underserved communities.
Hard to reach,
Hard to reach.
easy to
I
ignore.
know, I love that one.
All
Easy
of
to
those.
ignore.
There's all of those.
Breaks your heart. But yes,
Yeah.
so, you know, I am an ambassador for health inequalities,
You are.
and it matters a lot to me. I'm very passionate about doing what I can.
I
to
was
reduce it.
hoping for partnerships with groups. That's what you're doing,
Absolutely.
isn't it?
Yeah,
The
yeah.
reason I had to interrupt you there is because we
No,
are
it's
coming up
fine.
to a break
I'm
very
a yapper.
soon. This is Care Across Cultures with me, your host Mirban Hussain. We're talking about lung cancer screening today. We'll be back after this break. Mirban Hussain. We're talking about lung cancer screening programs. I've been, if you've just joined us, and I've been listening to Asha and Hannah from South Yorkshire and Bassettlow Cancer Alliance about their lung cancer screening program for faith communities. What we've talked about so far is, what is it? Why is it being done? Why is it important? And how many lives can be saved? We've talked a little bit about the mistrust, fear, what to do if you get a letter. And we've talked about some data in terms of 70% of people who get the letter are told that you're fine, which is an amazing response. It's an amazing thing. And the key message is that just because you've had a letter does not mean that you have cancer. We also talked about normalising conversations around cancer and treating lung cancer screening or any other screening letter that you get, whether it's bowel cancer, treating that as just as any other medical illness. Asha talked about diabetes. She also mentioned blood pressure. And these are the kind of things that we need to look. I'm going to go back to my colleagues now. If you're listening to us on Link FM 96.7, this is Care Across Cultures. Asha, how important is trust? I know we mentioned it when it comes to health messages. And also, what role do you think that faith and community leaders can take part in this?
So trust is crucial for everything, even when, as a team, when we are going out, raising awareness or putting any communications out there regards the program, we try to do it through trusted messengers such as your practice people, which is your nurse, your regular nurse that you see, or your GP. We really kind of work with them as, like you've just said, it's a co-production, it's a co-design together. Now, what we realized is when the engagement is being, when we compared the numbers and we found out that the people from ethnic background or different faith communities aren't coming forwards, for the screening, we are then again looking for that trusted messengers. And I think faith leaders, community leaders play a very powerful role. They're already established, they have credibility. They talk about a wide range of things with people that walk in or go to the communities themselves. And I think this is what we want to do, go back to that co-design, co-production again with the faith leaders and community leaders, where we can use that trust, within that community they've already established, and actually raise the awareness. When we try to do differently through our providers, that we say, okay, the scanners or everything, and a lot of people did give us feedback. They said, is it a scam? It could be a scam,
Yes.
It's not a scam. And when it comes from that trusted, and powerful, established, credible leaders, it really works. People act on it. And even myself, like if I don't trust it, I'm not going to take an action on it. This is me personally speaking. And how different is it to any other person? So this is what I think we need to use, that credibility. We need to use that established links.
And there's also that added safety, isn't there? Because if it doesn't work out, I can go back to the imam, can't I?
Yes.
So you said X, Y, and Z.
Yes.
This was my experience. So that gives an added sort of safety factor as well, doesn't it? Yeah. Okay. Hannah, from a health perspective, no, I'm not going to ask you that because it's been sort of answered by Ash. I want to talk about language and understanding, and I want to talk about this session tomorrow, because this is with the Kashmiri and Yemeni group who meet at the Unity Centre and have been meeting for a number of years. It's a mixed group, males and females, of mixed age ranges as well. Okay, there are some people I think in their early 80s, some maybe in their 30s, but there's quite a mix. Okay. What have you done to make sure that the information about screening is clear and accessible, especially for people who don't use English as their first language?
Yes, very good question.
A long question, I apologise.
No, it's fine. South Yorkshire and, Rotherham are very diverse in their population. And you know, featuring just the English language everywhere isn't going to reach as many people as we want to. So I mentioned about the letter. We've got the 12 languages on the back. I've also had the posters translated and the flyers, so you know, the information that I give out at events and things, and when I go visit GP practices to give them the information to promote in the surgery, I always ask them, have they got any patients who don't speak English? And you know, I give them the languages of the patients that they have, to try to reach those people and help them understand. As you know, you mentioned, we've got the video. We've got, I received it yesterday, a non-English voiceover for the event tomorrow. So I've got 5 of the main non-English languages in South Yorkshire and Bassetlaw, and those voiceovers will be going on those videos, just to help people better understand. You know, we can keep the English simple, but it's still healthcare, and we still need to get that message across. So sometimes people can be really good at English when it's not their first language, but there might still be those nuances that they don't quite understand, or know the word but not quite what it means. So to have those translations is really important, and as Asha mentioned, the people that those communities trust that can perhaps do interpreting for them. You know, you're more likely to go to somebody you trust to ask than, you know, well, somebody you don't, I suppose.
No, but yeah. But also I'm thinking that, you know, it shows a commitment from the organisation, from South Yorkshire and Bassetlaw Cancer Alliance, that, okay, we actually care about you.
Yeah, absolutely.
Yeah?
And sorry, when Hannah was talking about these languages, they're not randomly picked. We did a proper research. We went to public health, received, you know, we went to all languages spoken across South Yorkshire and Bassetlaw, and we had to look at the percentage of people speaking these languages that are registered government, like, you know, on the websites. And then we had to concise it to what an A4 sheet could fit in, and what, you know, the draft and everything.
Yes.
So it is data-based,
It is
data-driven.
I'm glad you mentioned that, because, you know, it's not just a random thing that...
No.
Mirban said that Mirpuri is a good one. Yeah? And talking about Mirpuri, because the one tomorrow is in Mirpuri, isn't it?
Yes.
Yeah, okay. Which is a great thing. You know, it's a great thing, because there seems to be a lot of misunderstanding, and I've, you know, worked in this field for 30 odd years, and when it was the Pakistani population in Rotherham, the Pakistani Muslims, we'll let's do it in Urdu. Well, they're mostly from Mirpur in Pakistan, and they don't really speak Urdu. Yeah? So then again, it's the message is getting lost. Yeah. But with Mirpuri, I think the other thing, one is that it shows that you care as an organisation. This is important, that you care about the people as well. Because you're going out of your way, and, you know, we're making sure that you understand this. Okay? And it helps it helps the population, you know, the people tomorrow, that actually I understand this. I don't need